సార్కి ఇచ్చి స్టార్ట్ చేయండి.
Hello everyone. Good afternoon. I am Dr. Sreekanth Appasani, medical gastroenterologist, KIMS Hospital, Secunderabad. Today, we will be discussing about the common gastro and liver issues happening during pregnancy. We all know there are some issues which happen to women during pregnancy. These are all because of the physical and hormonal changes which happen to the woman when a baby grows in the tummy. These things, the baby growing, the uterus getting enlarged, has some physical issues with the intestinal organs because our all intestines, liver, pancreas, rectum are all just beside the growing uterus. And the hormones which are produced during pregnancy also are excessive in volume during pregnancy. So these hormones also create some amount of disturbances to the intestine. So I will be highlighting a few of them, what precautions to take, how do we treat them, and when do you need to rush to a doctor. The common gastrointestinal trouble which happens during pregnancy is vomiting. We all know. It is called morning sickness. This is because of the hormonal changes which happen, which causes nausea and vomiting sensation, a pukish sensation. It can be managed by modifying some of the diet and a few medications given by the gynecologist. However, if this morning sickness becomes very severe and the patient continuously throws up and vomits, we call it as hyperemesis gravidarum. So this hyperemesis gravidarum is a type of sickness where patient continuously vomits. These are the people who need to come to the doctor, probably get admitted, because whatever you give keeps coming out. They might need injections, saline, and stabilization. We give antacids and antiemetic medication. That is, things to reduce the acidity, things to reduce the vomiting sensation, things to improve the motility, the movement of the intestine, so that the patient does not vomit. We need to understand that this is quite common during pregnancy. However, if the patient is not improving with medicines, suppose you go to the gynecologist and a physician or a gastroenterologist, and you have taken some acidity tablets or the vomiting medication, still you are not improving, then don't ignore it as, okay, it's pregnancy related thing. You might be having something else. The liver, kidney, and intestines might be having some issue. We might need investigations in the form of blood tests or rarely some scans and endoscopy to look for what is the cause of this vomiting. So any pregnant woman who is having continuous vomitings, already taking medicine from the gynecologist and the physician or the gastroenterologist, still not getting controlled, please do visit a gastroenterologist and get investigated completely to look for other problems which are causing these issues. Now, the other most common reason is acidity. Most of us do have it once in a while, but it's so painful because for the pregnant woman, it increases in severity. Now, why does this happen? Two reasons. One, the pregnant uterus, the uterus which is growing inside the tummy, is pressing on the intestines and the stomach. So the acid which is produced inside the tummy is coming back into the food pipe. It's because of the growing uterus. The second reason is the hormones. Progesterone, which is a hormone which is produced during pregnancy, when it is increased in volume due to pregnancy, it causes disturbances in the intestine. There is a food pipe sphincter, a gate, which prevents the acid from coming back from the stomach into the food pipe here. So that gets relaxed because of this hormones. So once that is relaxed, the acid easily comes back in the food pipe and a lot of gastric irritation keeps happening. So acid reflux and acidity problems are quite common during pregnancy. These actually increase as the pregnancy age increases. So how do we take care of this? This again the same standard ways, diet control. So we reduce the amount of oily foods, spicy foods, things which are bitter and tangy. We know that pregnant women like bitter and tangy foods, but it's better to avoid them. The second thing which we do is meal frequency. We reduce the quantity of the meal, reduce the volume to smaller quantities, and keep giving them at more frequent intervals. Suppose if you eat 4 idlis as a breakfast, probably it's good to take 2 at one time, give a 2 hour gap, and again take 2 more at that time. So like that, if you break your meals and breakfast and lunch and dinner into smaller portions and increase the frequency, probably the reflux can come down. Simple antacids to start with. Sometimes acidity controlling medications, which we call as proton pump inhibitors, are safe and can be used during pregnancy. The third important problem which comes to pregnant women is constipation. We all know people who are having, the women who are pregnant have a lot of food fatisms. They don't like to eat everything. So the amount of fiber intake actually comes down. So once the fiber intake comes down, constipation gets precipitated. That is one of the reasons. Again, as I told you previously, the hormones, the relaxation hormones cause a lot of dysmotility, that is movement of the intestine problems, and that also causes a lot of constipation. But more important than these two is the physical presence of the uterus just in front of the rectum. They both are very good neighbors. The motion containing rectum, the large intestine, last part, just above the anal canal. Just above the anal canal one is just behind the uterus. So once the uterus keep increasing in size, it presses. So if this is the rectum, this is the uterus. As the uterus goes on increasing, it presses onto the rectum and doesn't allow the rectum to empty properly or move properly, and that causes constipation. We can't really do anything to the growing uterus, so probably we need to change our dietary patterns, increase the amount of fiber-rich food, fruits, salads, green leafy vegetables. These have to be increased at any cost. The second thing is water content. Pregnant women probably decrease the amount of water because they can't drink a lot of water because of satiety. Again, the stomach is full because the uterus is pressing on the stomach. They can't actually drink a lot of water. So probably again, small quantities, increase the amount and frequency will help them in taking larger quantities of water and preventing constipation. Still, these two things do not help. Small doses of laxatives are quite safe in pregnancy, but should not be taken like over the counter. Go to a proper gynecologist or to a physician or a gastroenterologist and take the prescription for laxatives. Since constipation is common, piles and hemorrhoids are also common during the pregnancy. Again, the uterus compressing on the vessels of the rectum. There are blood vessels around the rectum. Those get compressed, and because of the pressure, they get swollen up. That's called as hemorrhoid or the piles, and sometimes they do bleed also. We give medicines most of the times for this bleeding piles, which are quite safe in pregnancy and can be taken. And we try to avoid any specific treatment like sigmoidoscopic banding, injections, or surgeries during pregnancy. We try to tide over the pregnancy with the help of laxatives, giving some medication to control the bleeding, and then treat for the hemorrhoids promptly after pregnancy if they are persistent. Now, these are the common problems during pregnancy. One, vomitings. Once it becomes severe, we call it as hyperemesis gravidae. Second, acidity and acid reflux. Third, is the constipation and the piles problem. Now, these are the common problems which become more during pregnancy. There are some special problems which happen to the body during pregnancy and can affect the GIT and the liver. The most important one is the condition where the liver gets affected. This condition causes a failure of the liver, causing jaundice, sometimes bleeding manifestations, comatose conditions, and sometimes life risky situations. There are different conditions which can get affected to the liver. One is fatty liver of pregnancy, acute fatty liver of pregnancy. A lot of fat suddenly gets deposited because of hormonal changes and the liver stops functioning properly. The other problem is HELP syndrome, hemolysis, elevated liver enzymes, and low platelets. There are some problems happening inside the intestine, the liver, as well as the blood system. So the platelets come down, the blood levels come down, and the liver gets damaged. The third one is a common problem during pregnancy, which we call it as BP. So a lot of pregnant women start developing leg swelling and they start developing BP. We call it as preeclampsia. So once it becomes very severe, it starts affecting the brain. Patients start developing fits, seizures. So these patients are called as eclampsia, and in this condition, the liver can also get affected. So any condition which gets worsening conditions of the liver probably need to be addressed immediately and should go to a multidisciplinary team. So this is important. We need to go to a center where both the gynecologist, obstetrician, the expertise care for treating the baby, because if the baby is born early, then the neonatologist should be available, and most important, a practicing gastroenterologist or a hepatologist, a liver specialist, should be there available to treat. So this multidisciplinary team approach is needed to treat these type of patients. The general treatment for all of these bad conditions which cause liver issues is a delivery. If the patient is close to the delivery date or crossed beyond 24 weeks, then they go for a delivery. And then post-delivery, most of these conditions automatically subside and improve. If it's quite early in the pregnancy, probably if it's life-threatening, it's better to go for a termination of pregnancy. So these are some of the conditions which can go wrong during pregnancy, especially with regards to the liver. However, these conditions are very rare. They have to be suspected only if you develop some symptoms like bleeding, jaundice, or some swelling of the tummy or feet. So overall, to summarize, pregnancy causes a lot of physical and hormonal changes which aggravates the common problems like acidity, piles, and vomiting sensations. Sometimes rarely it can relate to liver problems and cause damage to the person. So we need to address these problems quickly by a multidisciplinary team having probably a gynecologist, a neonatologist, and a gastroenterologist. Thank you. Any questions? Shiva? Okay. Thank you.